Well, Ms. Kane, may I call you Joan?
No, Miss Kane, please.
Fine. Ms. Kane, I'd like to, again, thank you for coming to this meeting with the team to talk about Joshua's care. As you know, he's completed the induction therapy, and I wish he had done better with the. I wish he had responded better to the treatment, but we have to. We want to discuss today what's going on and where we go from here. So let me start.
I know where we're going from here, but you can talk.
Well, let me start by introducing the team, and maybe each of us can introduce ourselves.
Sure. Hi, Ms. Kane. We've met before. I'm Christina. I'm the nurse who works on the oncology floor that's been Joshua's primary nurse.
Yeah, you're that nurse, right?
And Miss Kane, I'm Hannah. I'm a chaplain with the palliative team. I've met your son. He's so delightful. I know we've talked a time or two, and just here to support you spiritually as a chaplain, and want you to know that we really do care about you and your son.
Thank you.
Good morning, Miss Kane. I'm Polly. I'm the social worker here. We haven't had the privilege of meeting yet, but I'm here as part of the team to support you, especially during this meeting.
Yeah, we'll see.
So let me begin by, first of all, expressing the team's gratitude for allowing us to participate in Joshua's care. And maybe the best place to start is to ask you what your current understanding of the situation is.
I understand exactly what's going on, and I know that nurse got my son involved in something that I explicitly said I did not want him to be a part of. I would really like to understand why that happened.
My intention was certainly not to go against your wishes and have any conversation with Joshua that you didn't want to occur, but as someone who has been spending a lot of time with both of you, I think Joshua has become comfortable with me, and so he looked at me as a source of information.
He is the most comfortable with me.
I agree. He clearly adores you, loves you, and wants both of you to have what you need. I do feel like that's part of the reason that he's asked me some of the questions that he's asked me, is because
I understand
he's
that, but when
worried.
he starts to hear anything that is negative or not in a positive light, or not, allowing him to pray to God and to know that God is going to treat him and take care of him, it takes away his hope. And I will not have that, because I know that God is there for him and is in him and will care for him, and I want him to have hope. I don't understand why anybody would want to take away his hope.
I completely hear what you're saying. I would never want to take away his hope, and certainly didn't want to encourage that type of conversation that would make him feel like he wasn't allowed to be hopeful. I think we were all very hopeful that the treatment
And I continue
would
to be
go.
hopeful. Don't put that in the past tense.
Yes. I'm sorry. I apologize. I didn't mean to put that in the past tense, for sure.
Is it okay if I'm here for
There's
you?
no reason. There's no reason. I'm fine. I am fine. I just really want everyone to understand that I will take him. He will get to a trial. He will be okay. God will take care of him. You know that.
I agree
You
with you.
know that.
I
And
agree
I
with
don't
you.
understand. I am really starting to not trust this institution, this team. I'm just not trusting you. I was very explicit with what I wanted and how I wanted things to be handled with Joshua. Really want some answers.
Well, we certainly don't want to take away anyone's hope. And
Could have fooled me.
I would say, Joshua is a very bright 17-year-old, and
Was raised right.
he certainly is perceptive, and I think certainly we respect your rights to indicate how you want us to deal with Josh. But I think it's important to understand that he's a perceptive 17-year-old, and he is aware of what's going on. Now, I think. My concern is he is developing some symptoms. He has some discomfort, and we want to do everything we can to address that. And
Well, you can address that without sitting there and talking about the fact that things aren't working or taking away his hope or undermining me being his mother. I'm his mother. I know him best.
I'm sure that's the case. And
I just wanted to offer, I know scripture is really important to you, and when you're talking about Joshua and wanting to care for him and protect him, it reminds me of that image of when Jesus looked over Jerusalem and said he wanted to fold it under his wings like a mother hen, and you are such a good mother.
Mm-hmm.
I want to validate that. Also, I did stop by to say hi to Joshua just like normal in the late afternoon after Christina had talked to him, and he is still full of hope. He knows that God is taking care of him. So
He's now asking questions and now sitting there telling me that things aren't working and now talking about the whole idea of, well, should we continue doing this? That is taking away his hope. I am going to take him out of this hospital and I am going to have him go to another hospital that will actually listen to me and help him.
You want him to be helped. That's your main concern.
Yes,
you know,
of course.
we're never adverse to getting another opinion, but I think I would personally be happy if you have an idea of where you'd like to go to
St. Jude's.
to call.
I can get him up
We'd
to
be
St.
happy
Jude's.
to talk to them to get their input in terms of what they think is available before just suddenly exiting against medical advice, which it may cause him further discomfort, which I know you don't want.
He is doing very well right now. He is in his room. Everything is going along just fine. And I just want to take him out, and you all can't stop me.
That's correct, but we're not saying you can't take him wherever you want, but we can certainly try to help him by making some contacts with the other hospital before.
Oh, I think you all have done just enough already. I really do. I am just beyond upset about this, and Joshua and I are going to leave, and we're going to leave this afternoon. And we're going to go to St. Jude's. And there's really nothing any of you can say to change my mind.
We hear you.
Have you spoken to Joshua about that?
Oh, he will do whatever I tell him to do. There's no question.
I know, Polly, you had a case last week with a child similar age to Joshua. Is there anything that we can offer from the social work side for Ms. Kane?
Well, we certainly, I said I'm so sorry that I haven't met you till now.
Mhm.
We certainly would like to be available to you to help you in conversation with your son about next
Oh, I can talk to
steps.
him just fine. There's no worries. I can talk to him just fine.
I would be happy to be in the room with you
No.
and help you with the conversation.
Is there anyone that you want to call to be here with you so you have some more support going through this as a mom on your own?
I have my faith, and I have my God, and I have my child. That's all I need.
Okay.
Is there anything else we can do for you and Joshua?
No.
We're definitely here for you, even with you leaving us. We wanted
Well,
you to know.
I'm done with this meeting. I am done with all of you. I'm going to go pick up my daughter. I'm going to come back, and Joshua and I are out of here by 4 o'clock. Good day.
I have to say, I'm.
Oh my gosh.
I'm a little like it's kind of hurtful that she says I'm just done with you guys. I mean, we've kind of put our blood, sweat, and tears,
I
especially
did
Christina.
not mean
so
for
bad
any
for
of this to
you.
happen.
No,
I just didn't know
he's
what
the
else
one
to
who-
do. He's
the one
been
who brought it
talking
up.
to me. He's been bringing these things up, and I've been skirting it every time. And then the other day, he looks at me and is like, "You're not answering my questions intentionally. Like, this is intentional. Why are you not answering my questions?"
He knows, like Dr. Mazanek said at the beginning, he's perceptive.
Right, he's a smart son.
Yeah.
He knows much more than he's saying, and then she proceeds. No, you did the right thing. I think, I don't know what else we could have done. We did the best we could. And,
She doesn't want help. She
that's
at this
right.
point.
She's made up her mind.
Yeah.
Well, and he's protecting her. He's not asking her these questions because he's protecting her. And he wants to, he's afraid. It's the fear.
It's so sad.
What did he say? You were saying he said something like really poignant.
Yeah, he said, "I'm not going to get better."
Wow.
I mean, those were the words that came out of his mouth. And so, I mean, I knew what she wanted. So I said to him, well, tell me why do you feel that way? What's
Yeah, I mean, you let him.
what's causing you to have these feelings? And he said, I'm not doing treatments anymore. Why else would I not be doing treatments? He knows.
He knows.
Right.
Yeah.
You did a great job.
You
taking care of
did.
I
him.
just
And,
feel
like-
so responsible. I feel like the reason she's taking him, and what if something happens to him?
Yeah. I mean, it's a
Is
real.
because I had that conversation with him.
It's a real concern, but it's also out of our hands. I mean, I think we all did our jobs well.
She's
and
so angry.
I mean, we can't control that.
I wish I had been
Um,
involved earlier. I haven't been able to get to see her.
Yeah. Well, this admission, they've only been here 3 days, so
No.
I know you've got 40 other patients.
Well, but that's, it just makes you feel bad that,
Yeah.
not that anything I would have done would have changed her. She was,
I
Her
know.
mind was made
her
up.
mind was made
Well,
up.
and the other times that she's been here, and your colleague from the other unit, she did see her, and she's been consistent every time, like very short fuse. So it's definitely not you.
Well, again, I think the team did an amazing job. Certainly as the nurse, you were, he trusted you, he opened up to you. It would have never happened if it hadn't been for you, and he needed that.
Yeah.
He needed that. And she's going to do what she's going to do.
Yeah.
And it's so
Right,
hard with
right.
a 17-year-old. Like they are,
He knows.
they're
Yeah.
old enough to
Right.
make some medical decisions in our state, and so
I mean,
you were also trying to
ethically,
advocate for that.
Yes.
Yeah.
So
And I think that's where we've been trying to come to with her is that ethically he has a right to
Right.
know
Right.
about his medical prognosis and have a voice in what's happening to him. And that just clearly she was not going to allow that to happen. And I don't think it came from a bad place with her. That's certainly how it came out. But it was her also trying to protect him.
Oh, yes.
I wish he would have let us talk to St. Jude, and maybe
Yeah.
a transfer is always better than just walking out AMA.
Yeah.
Well, we will continue to follow them.
If she'll, I know we have a community resource that we have already introduced them to. I don't think she's allowed them to have much contact with him. They're a hospice provider, so she was very much against. Although we said it's not. This is for a child, and so it's very different. But I think she's talked to them a couple of times on the phone, so I'll give them a call and let them know what's going on, and just so that they can be aware and be in contact with them. But I'm not sure. I'm hopeful that they'll be able to stay in contact, and at least we can find out. I need to know for my own.
And I feel like we probably need to work with the staff too.
Yes.
I definitely want to set up a time to have a debriefing with the rest of the
Yes.
nurses and everyone who've been taking care of him because they've done such a good job.
Yeah.
And they're going to be
they're
devastated.
going to be
Yeah.
grieving, and I'm happy to tag team with you
That'd
on
be
that.
great.
Yeah.
That'd be good.